Hello everyone, welcome to my channel. And today we are going to discuss about this important article which is published in Biomed Central BMC Geriatrics. And this journal is indexed in PubMed, Scopus, and again Web of Science, all three major indexing services. And it is published in the year 2025. So it is a recent article, and this article focuses on the respiratory rehabilitation, telerehabilitation experiences amongst the older adults, that is, the people who are age of more than 65 and suffering from respiratory ailment, whether telerehabilitation is effective for them or not, whether their user experience, how's their user experience, and how is their satisfaction with the respiratory telerehabilitation program. So all of you who are planning to start with respiratory telerehabilitation from your in your clinic, you can go through this article. The results are very positive. So what the literature gap, what they have seen is there's rise in the telerehabilitation geriatric care in nowadays in the global digitalization trends. Okay, so they wanted to assess whether these programs are whether well taken by the geriatric population or not. Okay, so they conducted a qualitative study, that means a semi-structured interview to answer a research question. Okay, they have done this study design, a qualitative study design, which included semi-structured interviews to answer the research question. And the research question was, how do older people perceive telerehabilitation program? And 17 patients with respiratory ailment was included with age more than 65 into this telerehabilitation program, and it was conducted in Portuguese hospital. Okay, the interviews was submitted to the software analysis, that is WebQDA. This is the qualitative data analysis software. So this interview was analyzed using a software, and they have also mentioned the name of the software. So after the analysis, they have come out with the three themes of content analysis, that is access and continuity of the care. That means the individuals or the participants were able to access the care, and they were able to continue the care, and they were able to feel the presence of the team. That means there was a communication from the rehab team, and they were able to maintain the relationship and experience of the program, whether the program was comfortable, and what are the advantages and what are the difficulties of their program. So this was the article in short. Let's see what are the recommendations given by this research about the respiratory telerehabilitation program. So it is given at the bottom of the article. Okay. So it permits the presence in the care. That means they are able to continue the care through effective communication and maintenance of trusting relationship with the rehab team. Okay, that is the first finding what they have got. And they also recommend that the use of telerehabilitation was perceived as comfortable. Okay, so the patient or the participant perceived that it is comfortable, safe, and has economic advantage due to travel and is easy to use. Okay, so taking into account the advantages and benefits of this resource, it is used in the older people, is recommended, and especially in ongoing care. Okay, and they also recommend that the more research is needed to study the effectiveness. Now they have just studied about the how well it is taken, how feasible it is, but the more study is required to check the effectiveness and the usability of telerehabilitation program for older people. So I think it is well taken by the older adult or the individuals who are very old and not able to travel to your clinic. So telerehabilitation program is well taken and it is comfortable. They feel that they have access and continuity to the care, and that they feel the presence of the rehab team by maintaining the relationship with them, and experience is also good. So if you want to start telerehabilitation for your clinic, here is the research article for you, and it's published in good journal. So it took me less than 15 minutes to access this article and check its authenticity, whether it is indexed or not, and to analyze this article using AI tools. So if you want to learn all this, you can join my masterclass, which is upcoming on this Friday, and the timing is 9 p.m. and it will be on Zoom, and the fees is only 700 rupees. So you can join this and you can learn all these tricks, and you can stay updated on the research and also apply the evidence based to your evidence and research to your practice. Okay, thank you. See you soon. Thank you.